Well, how are you doing today? This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk today about the straightwise way of correcting these cases where have a cleft palate cases. Now this is done by old surgeons, and anybody can do this type. I mean, any kind of orthodontist, you send them to oral surgeon and they'll do this. But I scrubbed in on one, and then I took pictures of it as they treated it. I knew the old surgeon working, and also the regular surgeon was helping him do this case of a cleft palate. And the periosteum is something you have to learn about. It doesn't stretch hardly any, and so they have to make room for it. So I'll show you that as we get into the case here. We've got a lot of things that need to be done on that. And here is a young man who has this cleft palate, and the palate is open, and actually his nasal drains into his mouth over here somewhere. And they're going to have to go in there and close that up. And they had to use bone from his body, and so they operated on his hip and took the bone off of the top of the hip back here and put in this, they ground it up and put it in that deal, and then close the periosteum over it. But to get the extra length for it, I'll have to show you. All right, here's the case. And the teeth are way off to one side, the midline's off, everything, and he's got a drainage where this drains out into his mouth from his sinus. And he really wants to get this fixed. So this is the models, and he has a lot of orthodontic problems. We had to come back and finish it up orthodontically, straighten it all out after we got the cleft fixed. And the cleft is going out through that space right here. Now what you have to realize in cleft palates, and most of them are done when they're real young, but the periosteum will go up here and go back, then it'll come in from this side like that, and you can't jump across where the periosteum is. So they'll have to go in here, and they go all the way around over here and cut it, and they can stretch it, bring it out, and they'll sew the pieces together, stuff them back in here, and fill that with the ground up bone from the hip there, and it covered over, and the bone takes place, and then they correct these two deals like that, and that shuts that hole up. Now you can come in and move these teeth around. You can't move a tooth through periosteum and get them out like that. At least that's what they say. You cannot. It is a tough material over the bone, so you have to cut it, stretch it out over here, pull this up and tie it, and then the periosteum that comes in here you tie together, and you tie it here and here after you fill this with bone structure there. So we'll see what we do here. Now here is the cephalometric, well, panorex of his deal. And this is drained from the sinus up here, coming into his mouth, like that. And so, and the case was crowded up here a little bit. We needed some space, so we took these teeth out. At least I've got it here, and we're going to use his wisdom teeth, and he probably have to have these taken out. He doesn't have the room for them. All right, let's go on through with the case. All right, we went in, we put braces on him and everything like that, but we had to go in and do the surgery before you can bring these teeth together over here. And so here it is after we finished it like that, and we brought the teeth together at that point. right there. And now this is where the opening here, this is draining from his sinus right into his mouth. And what they have to do is go in here and we lay a flap in there, and then they cut the periosteum all the way around and cut it back here, and this where it was circular here, they cut it, and they pulled it around, and they tied the pieces together here. Well, they tied these first, filled this up with bone structure. They chipped off the hip, filled that in, and then pulled this over and sewed it together there. And now you could do the orthodontics and move the teeth through that bone, of that periosteum bone coverage. And here it is after we did the case. I'm sorry for this. This is an old case and it's been in for a long time and the fungus grew on it. But that's the opening, it came into the mouth that way. Sorry for that type of x-ray, but that's all I had to show you. Now here is the surgery. It's going to be bloody now, so if this was, we put him to sleep and everything, and I was allowed to take pictures as they went along with the work. And they opened that, and they trimmed that, they cut that periosteum all the way around. This is a bloody mess now. This is going to turn some people's, but you got to look at that. Now they had a lady there aspirating everything. And they cut it all the way around and loosened it up and pulled it over the top of that and had enough to sew together. And here they went in over the top of the hip and trimmed off this bone structure. Then they mashed it all up and they had it sewed up on the inside. They stacked that in there and then pulled the periosteum over, tied it on the outside. So you have it going this way and this way, and you cut it. They went back here and stretched it, pulled it over, tied this part together. But you tie the inside of it here down on the bottom, put the bone in there, and then they tie this together on top of the bone. And you get the bone off of that person so it he doesn't refuse it, his body doesn't turn it down. So anyway, that's the way you do a cleft palate. You cut that periosteum all the way back and pull it in there, then tie it together. And that closes up the gap. And when we went in and finished the case after that, straightened the teeth up and just regular orthodontics after that. But you could see this place where the tissue healed. And this is where it was tied together and filled that with bone and tied this up. It was tied on the inside too. And now you can move the teeth across that area. Surgery is an amazing thing, and I've scrubbed in on surgeries with the people. This is some more fungus growing these before I knew it. So this is the end of the case. We finished it out, and everything worked good for him, and that closed this gap up above. So I've tried to cover everything associated with orthodontics, and we pull this up and we do it in straight wise orthodontics. So thanks for watching, and I'll hang up here and hope you'll watch this and join our group. Thank you now.